How are you, dementia caregivers? This is Risa Carlton, your host, physical therapist, and dementia coach, for another episode of Empowering Dementia Caregivers podcast. A person with dementia is usually misunderstood with the early signs of dementia symptoms and changes in behavior. As a family member, it is so important to understand that the behavioral changes that are happening to your loved one are actually changes in the brain as the dementia symptoms progress. I worked with family members and caregivers of clients with dementia. Most of them get very frustrated, angry, and upset dealing with the challenging behaviors of their loved one, resulting to their loved one being misunderstood and being difficult to care for. Caregivers would vent out to me comments like, "My mom's dementia is not that bad. I know that she is acting that way intentionally to make my life harder." Or another family member would say, "My dad is my dad used to be kind and patient. Now he is very stubborn. He is being difficult. He argues with me all the time." Another comment would be, "My grandma is acting so needy like a child. I know that she is doing that just to get more attention from us." I believe in my faith that God allowed this very humbling experience of living with dementia symptoms personally for a few months to understand what actually my clients with dementia go through. And I'm telling you, there is no room for faking these behaviors. My son was about 8 years old at the time when I experienced the temporary dementia symptoms. He got very upset and frustrated with me because of my worsening memory loss and forgetfulness. I was missing his soccer practice and his guitar lessons. As I struggled through the dementia symptoms every day, inside of me was the feeling of frustration, anger, and embarrassment because I could not perform the simple daily task that I used to do independently and without help. Your loved one feels exactly the same way as I did. My goal as a dementia advocate and a dementia educator is that by empowering you, caregivers, with a much needed caregiving tool, is that you will be able to care for your loved one with more understanding, love, and compassion. And also to make your caregiving role easier, reducing the stress and the burden of caregiving by learning the positive and effective caregiving approaches. In this episode, you will learn the simplified and practical way of understanding the brain with dementia, focusing on the parts of the brain that are responsible for memory, learning, behavior, emotions, and thinking skills, as well as the related symptoms of dementia as the brain deteriorates with dementia. All right. This is the human brain model. So this is the forehead and this is the back of the head. And so for orientation, it would be this way. All right. Now, the brain of a person with advanced dementia is compared to the brain of a child in a brain imaging. As the brain cells die and the brain shrinks with in a person with Alzheimer's disease, it is about the same size of a child's brain. It also lost the ability and the function to think reasonably and safely with these changes. Now, don't get caught up with the anatomy, the medical terminologies. My goal is to give you the basic knowledge and idea of the human brain, and more so to focus on the challenging behaviors, the behavioral changes as the part of the brain deteriorates with dementia. All right? So the cortex, this is the cortex. It is considered the executive center of the brain because it is responsible for higher thinking skills like decision making, problem solving, reasoning, and judgment. The cortex consists of the frontal lobe, the parietal lobe, the occipital lobe, no, the temporal lobe, and this is the occipital lobe. The frontal lobe is responsible for memory, problem solving, verbal expression, safety judgment, initiating an activity. What else? Controlling impulse, social interaction, and sexual behavior. I worked in a skilled nursing facility in my first few years of physical therapy practice. We had a male senior patient we were working on in therapy. He presented symptoms of increased confusion, no diagnosis of memory loss or dementia. This was about year 2005. We were hearing complaints from the nursing staff that this patient was acting inappropriately with inappropriate sexual behaviors and sexual comments toward the nursing aid staff during showers and toileting activities. He is a tall, heavy-set patient. The nursing department requested therapy to do transfer training in service with the nursing aid staff, showing them safe transfer from patient's bed to the wheelchair. So I performed the transfer training in service in the patient's room with the nursing aid staff. The patient was lying in bed. Being a short, petite Asian physical therapist and working with a tall, heavy-set patient, I had to get into the bed on my knees. So I was able to reach in and be able to place the safety belt around the patient's waist before instructing the patient to sit at the edge of the bed. So in that position, the patient then placed his hands on my bottom and he was smiling at me. I was a new grad out of school physical therapist at the time, and for me, that was a very shocking and embarrassing experience doing the transfer training in service. The facility decided to take disciplinary action toward the patient's inappropriate sexual behaviors to the staff. So the facility decided Baker acting the patient. Now, in a normal brain, a male lying on his bed and a female getting into the bed and in front of him would trigger a sexual response. With this patient having memory impairment, he didn't have the filtering system, the reasoning, and the judgment skills that I was a healthcare worker and not his partner. So he acted a sexual response, which was grabbing my bottom and smiling at me. Now, looking back to this patient care approach that patient being Baker acted, I say this very objectively. Shame on us, healthcare professionals. Baker acting the patient when it was us lacking the clinical knowledge and clinical expertise to care for and appropriately and fairly address the patient's memory impairment and challenging behaviors. Now, temporal lobe. Get my notes here. All right, temporal lobe. Oh, we'll do parietal lobe. So this is the frontal lobe, the forehead. Parietal lobe is this part. So for human head orientation would be here. This is the frontal lobe. This is the parietal lobe. Now, parietal lobe is responsible for translating sensory information, pain, touch, taste, temperature, pressure. It helps us the ability to judge the size of an object and judge distance. It also helps translate written and spoken words and symbols like numbers and puzzles. The dementia symptoms associated with the parietal lobe deteriorating, there is dysfunction in the senses, memory impairment with delayed responses to questions or instructions. There's difficulty in speaking and understanding words and difficulty in doing math. Your loved one will show struggle in balancing their checkbook as the ability to recognize numbers and symbols are impaired. They also struggle in identifying objects and their use. I would have patients that would mistaken a TV remote as a phone, or the caregivers would report to me medicines are mistaken as candies by their loved one. This is also the reason why your loved one is wearing a sweater and the house heater is on during the summertime, because this part of the brain that is responsible for gauging the body temperature is affected. I did a home health visit in an assisted living facility memory care unit. When I walked into the patient's room, I found the patient passed out, laying on his bed. He was wearing layers of long sleeve clothes and a heavy sweater. And the heater was on in his room. The facility had to call EMS and the patient was taken to the hospital. What happened there was the patient's body thermostat was not working effectively because of the deterioration in the brain. And that was the reason that he was wearing inappropriate clothing related to the weather. And that's why constant supervision is very important for your loved one for safety. All right. Temporal lobe is this part of the brain, and it's where the ear is. All right. Temporal lobe is the hearing center of the brain. It translates what we hear, speech and sounds, and translating them into meaningful words and or movement. It is for the temporal lobe that we understand someone speaking to us. Dementia symptoms, when the temporal lobe is deteriorating, there is difficulty in understanding spoken words, which result to delay in or difficulty in responding to questions or instructions. So you would notice your loved one, like you would tell them to do something, and they were looking like they didn't hear you. They are not ignoring you. All right. Um, Another symptoms for the parietal lobe deteriorating would be confusion and changes in behavior. Now, hearing is less affected in a person with Alzheimer's disease and other types of dementia. When you think that your loved one is being hard of hearing, you have to pay attention closely before considering hearing aids. As in some cases, the hearing ability is good with your loved one. They can hear the words, right, from the ears, but it's not being processed and translated into a meaningful words or movement, and that's the role of the frontal and parietal lobes. Now, occipital lobe, all right, would be the back of the head, all right, here. All right, occipital lobe is the visual center of the brain. It processes and interprets everything we see. It analyzes colors and shapes, depth perception, movement, um, identifying object, and face recognition. Dementia symptoms, when occipital lobe is deteriorating and affected with the dementia, there's tunnel vision and difficulty in identifying colors and shapes and recognizing objects and facial recognition. This is the reason that your loved one is not able to recognize you as a family member or a friend caring for them because they lost the ability to recognize familiar faces. Tunnel vision happens as the dementia symptoms progress. With tunnel vision, your loved one can only see what is in front of them. All right? What they can only see what is in front of them, and peripheral vision, side vision, is gone. So I recommend and I coach caregivers to approach and speak to their loved one at eye level and in front of them, so to help them be able to see the person speaking to them and assisting them with their care. All right. Now let's talk about limbic system. All right. So in the developmental stage of the brain, the limbic system is considered the inner brain, So it's right here. It's inside the brain, so inner brain. And it is the brain that is developed first, and then the cortex, the outer brain. All right? The cortex being developed last and loses its ability and function early on with the dementia. Limbic system, on the other hand, because it's considered the primitive brain, it was developed first, it is the part of the brain that is preserved in a person with dementia. And as we discuss, the roles and the function of limbic system, you will understand the importance of this part of the brain, for understanding the behavioral changes of your loved one. Now, limbic system consists of hippocampus, amygdala, and hypothalamus. Hippocampus is responsible for storing long-term memories, emotional memories, and movement memories. This is the key part of the brain for learning new things. The short-term memory is turned into long-term memory and stored in the brain. A person with dementia is capable of learning new things in the early stages when the activity or the routine is being done in a structured, consistent manner. So the repetition principle applies with the hippocampus. All right? Dementia symptoms with the hippocampus deteriorating, there is the inability to recall recent events. It's the storing center for memories, and the memory loss, the forgetting where they place things, difficulty following instructions, they get lost in familiar places, and asking the same questions repeatedly. Amygdala is the key part of the brain for emotional control and processing. It plays an important role in regulating emotional responses such as feelings of hunger, thirst, pleasure, anger, fear, and anxiety. It is the brain that responds to the fright, fight, and flight situations. So dementia symptoms, with the amygdala deteriorating, there is increased in anxiety, irritability, fear and panic, changes in behavior, changes in mood, confusion, and they have a decreased ability to store and retrieve memories. In a normal brain, amygdala responds to threatening situations. For example, we hear gun shooting. Our immediate response would be we get frightened, we run, and we go to safety. This is the amygdala working with the fright, fight, and flight reaction. Now, with your loved one with dementia, they respond to feelings of pain, hunger, thirst, feeling tired, or feeling sleepy as a threat. And they are unable to communicate their need for comfort, so they will show nonverbal cues, responses like moaning, being restless, crying, or screaming. Memories with strong emotional meaning tend to surface with your loved one. They remember long-term memories with special meaning, like smelling baked cookies remind them of Christmas time with family. And the same thing with remembering memories with strong negative meaning, like past events that make them feel angry or fearful. So it is good when your loved one remember those good memories, right? The family traditions and telling you good stories when they were little, and now dealing with the negative emotions. They remember things like past events that was traumatic to them, fearful, and that was that's the time when we do calming technique and help them to reduce the anxiety and the fear. Now, hypothalamus acts as the regulator for emotional responses, controlling appetite and regulating body temperature. It helps regulate hunger and thirst, mood, blood pressure, sex drive, and sleep. The dementia symptoms, with the hypothalamus deteriorating, there is loss of appetite. And this is very common in the later stage of dementia. Um, there can be a weight loss or weight gain. Weight loss is the loss of appetite. Weight gain could happen. I had caregivers that report to me because of the dementia, and not remembering that, the loved one not remembering that they just ate lunch. I would say like 30 minutes ago. They would keep asking for food or eating, and that's when weight gain happens. All right. There is changes in body temperature, and sleep issues. This is when they start to stay up at night and sleeping in the daytime. Now, here is the takeaway on understanding the brain of your loved one with dementia. As the dementia symptoms progress with your loved one, they will not be able to express, voice, or communicate their needs and feelings. The effective way of caring for them is to focus on the parts of the brain that are spared and still working, which is the limbic system. The limbic system is the emotion center of the brain that we can stimulate to get emotional responses from your loved one and responding to them with emotional responses like um, holding their hand for comfort, hugging them, giving them gentle strokes on their body for comfort, um, touch therapy, play their favorite music, or sing their favorite song as a calming tool, reducing the anxiety, the stress, and that will calm them down. I hope that this episode is valuable and helpful in your caregiving with your loved one with the challenging behaviors. Be empowered, dementia caregivers. Till next time.